Dr. Sylvester Nicol, physician and health services pioneer.
Making a difference in your world.
Freetown, Sierra Leone's bustling capital city, sits on the slopes of mountains that slide steeply into the Atlantic Ocean. During 10 years of civil war, Sierra Leone's institutions crumbled from widespread corruption and the mass exodus of the country's professional class. None more so than the health sector. Today, a population of 6 million relies on the services of just 77 doctors. Many Sierra Leoneans in the country's diaspora are now considering coming back. One of the few to make the leap is Dr. Sylvester Nicol. He moved home in 2008 after living abroad for 14 years. He left behind a successful medical practice in the United States to establish a unique facility in Freetown.
And the concept was to have as many services under one roof as possible. This is a common concept elsewhere in the United States, etc. But in Freetown, usually after you see a physician, you might have to go somewhere else to get a lab and somewhere else to get an x-ray.
Dr. Nicol built and manages the medical centre, which offers outpatient laboratory and x-ray services, a pharmacy, and more sophisticated services such as ultrasounds and specialised lab work. The centre also has an intensive care ward.
What I love of my job is the fact that people can get better. And if you do it well, quickly. It's very, very rewarding. Hello, Sir Gabo. How are you, sir?
Dr. Nicol believes that a strong private sector is key to social development in his country. He believes his medical practice will convince others in the diaspora to move back home and rebuild their country.
Yes, I think it's an incentive for people to come back, especially the middle-class folks who are the ones who drive the economy. And they need and they're used to a certain type of health care.
Sukai Al-Ghali moved back to Freetown from London 2 years ago. She has trouble with high blood pressure, but says the other health facilities in Freetown are not up to standard.
The center is a godsend. I think for a doctor to leave America to come here, it must be, he must have the love of the country.
Although consultations cost only $15, many Sierra Leoneans cannot afford the services at the medical centre. But Dr. Nicol treats everyone who comes his way and tries to balance his business between those who can and those who cannot pay.
In Africa, you have to have services for people who can't pay the $50,000. Just as a medical person, you treat people who come through your door, and you worry about being paid later.
It's not easy to operate such a centre in Sierra Leone. Clinics here must cope with regular power cuts, a lack of trained medical personnel and drug shortages.
That's a huge challenge. But any significant thing you do, it has to be challenging for it to be rewarding. So I think it's going to be rewarding.
Dr. Nicol has no regrets and no plans to move back to the United States. Fid Thompson for VOA's Making a Difference in Freetown, Sierra Leone.